Today class. In this video, we are going to study the different functions of acupuncture and Moxibustion, the principles of the treatment, as well as the factors that's affecting the treatment. When we say that we are studying acupuncture and Moxibustion, which means we use acupuncture and Moxibustion to treat diseases. But how does it work? How does acupuncture and Moxibustion work? What's the reason that we can use these needles or these heat, the monster stick, to treat diseases? What's the reason behind our treatments? That will depend on the functions of the acupuncture and Moxibustion. There are three functions of acupuncture and Moxibustion. Firstly, smoothing the meridians. The smoothing the meridians, you can use the other term, unblock the meridians. So to unblock the meridians to make the flow smoother. That's one of the most important function of the treatments. The second function is strengthening the antipathogenic qi and eliminating pathogenic qi. From the second function, we understand that the treatment of acupuncture and Moxibustion, it can improve antipathogenic qi, which means acupuncture can maintain health, can improve your immune system to help you to maintain health, to prevent being sick. That's why during the COVID-19, some hospitals in China, they use the Moxibustion. They burn the moxa sticks in the hospital. They create the smoke in the air, in the environment. Why are they doing so? There's two reasons. One is the smoke from the moxa is fragrant, so the smell of the smoke is fragrant. The fragrance can clear the dampness, can eliminate the pathogenic qi of the COVID virus. So the COVID virus we consider as the pathogenic qi. The smoke, the fragrant smoke, can help to eliminate. The second is the smoke from the moxa. This smoke can strengthen as the antipathogenic qi. That's why they use the smoke. They burn the moxa in the hospital to prevent the transmission of COVID-19. So when you see the phenomena, it is actually have knowledge behind this phenomena, and why it works. How does it work? It's because it has it works in two different aspects, including your antipathogenic qi and the pathogenic qi. The last function of the acupuncture and Moxibustion is regulating yin and yang. Regulating yin and yang is one of the most important and basic function of acupuncture and Moxibustion. As we mentioned previously, in Chinese medicine and acupuncture, regulating yin and yang is very important to keep the balance of yin and yang. But when you understand the yin and yang, this is too vague. You need to understand what exactly we are balancing. How to balance yin and yang. So what are we balancing the yin and yang? We're balancing the superficial and internal. We're balancing the heat and coldness in the body. We are balancing the upper body and the lower body. This is the regulating, how to regulate yin and yang. Another example that we can see is like in acupuncture, during the treatments, we use the reinforcing technique and reducing technique. Why we said that's reinforcing and why we said that's reducing? From the modern science, not the conventional medicine, but from the modern science, the technologies. They can feel if we perform the reinforcing technique on patients. We can use the machine to test the heat of the body. You can see the image. That kind of machine, you can see the red color of the heat. You can see the heat in the upper part of the body. The lower part of the body become cooler. That's the function of reinforcing and reducing. So some of these functions can be seen from the science, from the technology. The dredging function or the smoothing function of the treatment of the acupuncture and moxibustion treatments is one of the most primary and direct function. In Chinese medicine theory, we all understand that the pain, we said that whenever there's a pain, there's a blockage. So when we say to relieve the pain, we said we unblock. We unblock the meridian, we unblock the qi flow. We activate the qi flow, we activate the blood flow. So the blockage can cause different kinds of pain. Whenever there's blockage, there's a pain. As these treatments can unblock the meridian, can smoother the meridian. So the analgesic function is one of the most direct and basic function of acupuncture and moxibustion. As described in 黄帝内经 from Lin Shu, described as whenever we see patients with either the extremities or the internal organs, the swollen and pain in the extremities or the organs, this is due to qi stagnation or blood stasis. We can use acupuncture or moxibustion to balance, to unblock the flow. However, as we study the differentiation methods in the diagnostics, we understand this, the same kinds of pain, the same symptom of pain, it might due to different causes. So in our treatments, we're going to identify different causes of the treatments, and according to causes, we're going to choose different type of treatments. This will depend on the function of acupuncture and the function of moxibustion. What are the functions of acupuncture? What are the functions of moxibustion? So you can refer back to the acupuncture and moxibustion we have discussed in last year in the class. What are the functions of moxibustion? Only when you understand the function of the moxibustion, you will know when to use. So the same blockage, the manifestations are the same. Blockage of the meridian. The blockage of the meridian, the patient may present as swollen, redness, or pain, or paralysis. Although in the slides you see in two different columns, actually these symptoms can be the same reason or different reasons. So we're going to identify the causes. For example, a patient suffers from swollen joints, suffer from joint pain, and you can see swollen. And from the differentiation, you think that this patient is suffering from the wind cold attack, accompanied with the dampness. The patient have the cold sensation in the joints. The patient will tell you that they were experiencing sparing of the muscle. In this situation, it is an excess syndrome, and then you will use acupuncture to dispel the wind and dampness. You also can activate the blood circulation, removing the stagnant blood. How to remove the stagnant blood? How to activate the blood circulation? Acupuncture can work. You also can choose different points of the acupoints. Some points are more focusing on activating blood. Some are more focusing on the qi stagnation. So you can choose different points. And eventually, this treatment can smooth the meridian and the patient can feel relief from the pain. Another patient may suffer from paralysis, impairment of atrophy of the extremities. In this situation, we may diagnose according to, so the diagnosis or the pathogenesis is not only from these symptoms. We only make it right here as an example. So in order to diagnose qi stagnation and blood stagnation, you won't be able to diagnose according to these symptoms only. We just use it as an example that the patient may present as this, and then you diagnose as qi and blood stagnation, malnourishment of the meridian. In this situation, what can you do? You can use Moxibustion to tonify the qi and blood to warm the meridian and tonifying. As you can see here, we use two different examples, especially from the explanation after the intervention, why we use acupuncture and why we use Moxibustion. You will see that the differences, one of the most important differences between acupuncture and Moxibustion is that acupuncture is used more for access syndrome. Acupuncture is more for access syndrome. Moxibustion can use for deficiency. We can use Moxibustion to warm the body, to tonify the qi and blood. Which means Moxibustion is more likely to be used in a cold condition. A cold condition will result in poor circulation. The poor circulation may be the poor circulation of qi and blood. And then this is the qi and blood stagnation. The qi and blood stagnation also may be due to the pathogens. For example, if you go back to the left column, the wind, the coldness, dampness, or even phlegm. Once these pathogens block the meridians, the patient may present as qi and blood stagnation. But this stagnation is an excess syndrome. Another stagnation is deficiency cause stagnation. So you need to include other symptoms in order to diagnose what kind of syndrome, and this can help you to decide which treatments you want to perform on this patient. Although we use the example here, it seems that acupuncture and Moxibustion, there's a clear line between acupuncture and Moxibustion. Acupuncture is used for excess syndrome. Moxibustion is used for deficiency syndrome. Moxibustion is used for cold condition because it can warm the meridian. However, we need to understand that acupuncture and Moxibustion can be applied together. This approach was proposed by Dr. Sun Simiao. You still remember Dr. Sun Simiao, the one who proposed R point. He proposed that we can use acupuncture to unblock the meridian. We can use the Moxibustion to warm the meridian. This is aligned with the clause in Lin Shu. It describes that whenever the situation is not suitable to be treated by acupuncture, we can use Moxibustion. So as you can see from these two examples, the same blockage of the meridian We can use acupuncture. We also can use Moxibustion. It depends on the causes, especially if a patient suffers from the different kind of pain due to heat. For example, this one, the wind cold dampness. If due to wind heat dampness, it's more suitable to use acupuncture. And although we use this example as an acupuncture treatment, this patient, we also can apply Moxibustion along with acupuncture. The reason is because this patient suffers from cold pain. The cold condition, the cold situation, we can use the function of warming function from the Moxibustion. So this patient, we actually can use acupuncture or acupuncture accompanied by the Moxibustion. That's a combination of acupuncture and Moxibustion. So the treatment will depend on the syndrome differentiation. What kind of syndrome? So the analgesic function is one of the most important and most direct function. In order to achieve the function of unblocking the meridian, the De-Qi or Qi arrival sensation is very important. This is a sign of the treatment, the efficacy of the treatment. Why sometimes the same points, the same prescriptions of the acupoints, some practitioner they perform doesn't work. The other, when they perform, it works quite well. What's the difference among these different phenomena? The same prescription, the same acupoint, why sometimes it works better, why sometimes it doesn't work that well? One of the reasons is De-Qi. The Qi arrival is very important. This is also a sign of the efficacy of the treatments. So the sensation of the Qi arrival, the patient may feel as the heaviness, numbness, or distending feeling, or kind of swollen feeling. This kind of sensation, even the pain, is a kind of Qi arrival sensation. So these sensations are very important for the treatments. That's also why in the practicals, we focus on the treatments. We ask you to practice. That's why we ask you to practice one by one. Why we ask you to practice on yourself. If the patient couldn't describe what kinds of situation, the sensation. For example, a patient they could not talk. In this situation, such as after stroke, the patient got speech disorder, or in a kids, this is the patient the kids could not describe accurately. What can you do? Begin to feel from the sensation from your finger as a practitioner. We can feel the feeling from the finger. That's how is the qi arrived or not. That's the sensation will change from your finger, and also we can see the signs of the reflection of the patient, such as the large intestine 11. When we manipulate, when the qi arrival, the qi is arrived, the patient the fingers may twist once or twice. This is a sign of the qi arrival. Sometimes, as we said, that the qi arrival is very important for the treatments. But sometimes in your treatments, no matter what you do, the patient doesn't feel that much. What are the possible causes of this situation? Firstly, you have to insert the needle correctly. The location is very important. Direction also very important. If you have done everything correctly, the patient still don't feel the qi arrival. the patient still don't have the sensation of heaviness or distending feeling. This might be the poor or the weak body constitution. In this situation, what can we do? We don't leave the patient alone. We don't leave there, okay, because you got the weak body constitution. That's your problem. I can't help. In the treatments, we need to use the manipulation technique, such as the twisting, the lifting and thrusting, and the pressing along the meridian, the flying technique, the trembling or the shaking technique. We're going to use different technique to promote the qi arrival. This is the only way to improve the efficacy of the treatment. Actually, the faster or the quicker the qi arrival, the better result it will be. The second function is strengthening the antipathogenic qi and eliminating the pathogenic qi. From this term, you will see that we actually describing two different aspects. Also, two very important aspects that we discussed in the basic theory, the onset of diseases or the prevention of the diseases. We focus on two different aspects. One is your antipathogenic qi, how strong the qi can help you to protect yourself. The other is how strong the pathogenic qi is. The pathogen is, no matter what we do, no matter in Chinese herbal medicine or acupuncture, all what we do, we are focusing on strengthening the antipathogenic qi and eliminating the pathogenic qi. That's the balance, the fight or the battle that we use as a metaphor. The fight between the antipathogenic qi and the pathogenic qi. The theory is the same. That's why, although our program will be focusing on acupuncture, the basic theory, the diagnostics are exactly the same as Chinese herbal medicine. The only difference is instead of using herbs, different type of herbs, we use different points. We use acupuncture or moxibustion instead of the herbs. The indication, the function of the herbs, and the function of acupuncture points. The aim of these treatments is exactly the same. We want to improve the antipathogenic qi. We want to improve your immune system. We want to eliminate, we want to reduce the pathogenic qi. That's why we can use acupuncture and moxibustion to maintain health, which means you can use acupuncture and moxibustion on healthy person to prevent diseases. From this function of antipathogenic qi and strengthening antipathogenic qi and eliminating pathogenic qi, it will depend on the individual situation. We either strengthen the antipathogenic qi, or in other words, we either tonify or reinforcing. So when we say reinforcing, we say the technique. When we say tonifying, we talk about tonifying the body, the 脏腑 organs. No matter which way, the purpose is to strengthen the antipathogenic qi. If a patient suffers from excess syndrome, our treatment will focus on eliminating the pathogenic qi. So, have you seen the difference from these terms? Firstly, if the patient suffers from deficiency, we're going to strengthen, we're going to tonify the 脏腑 organs. We're going to use reinforcing technique to strengthen the antipathogenic qi. If a patient is suffering from excess syndrome, we're going to use the reducing method. We're going to use the acupuncture or Moxibustion to reduce the pathogenic qi. However, in some situations, we can combine them. So, similar to the acupuncture and Moxibustion, there's no clear line between the acupuncture and Moxibustion. There's also no clear line between the strengthening and eliminating. It all depends on what you want to do. What you want to do is not from your choices. It's from the patient's condition. You may choose to strengthen or to tonify the antipathogenic qi. You also may choose to reduce the pathogenic qi. However, if a patient has a weak body constitution, for example, if a patient got spleen deficiency, this patient always feel fatigue, lose stool, poor appetite, pale tongue with teeth marks in general, and then all of a sudden, the patient suffers from flu, from cold, or even pneumonia, cough a lot of phlegm, severe cough, a lot of phlegm, short of breath, even chest pain because of even sore throat because of the coughing. So in this situation, what can you do? We're going to reduce the pathogens. In the meantime, we're going to strengthen the antipathogenic qi. We're going to tonify the spleen. We're going to tonify the spleen to help the spleen deficiency, to improve the spleen deficiency. So as you can see from this example, in the treatments, in one prescription, we're going to focus on both the antipathogenic qi and the pathogenic qi. How to tonify and how to eliminate the pathogenic qi. From the lectures, we discuss nicely that you can tonify, you can eliminate, but how? We can use the manipulation techniques of reinforcing and reducing, depends on the condition. So that's one aspect that you may think about. The second aspect is the function of different points. Some points have specific function. Some points are more focusing and tonifying, such as the Ren points, the points on Ren Meridian, especially the one below the baby button, Ren 6, Ren 5, Ren 4, and also the baby button. These are all commonly used for tonifying. Some points are good at reducing, are good at eliminating pathogens, such as large intestine 11 and 指泽. 指泽 is lung 5 or 6, the one in the elbow. So you can just check the numbers. Or 曲泽. So I'm going to write down here. You're going to check the numbers. QU. Large intestine 11. And then 尾中 bladder 40. So double check the number. Ren zong is right in front, above your upper lips. These are more focusing on reducing. Also the Jing well points of each meridian. So we got 12 Jing well points on each meridian. These points are also good at reducing. If the patient suffers from excessive syndrome, we can use these points. You can choose these points. On the specific points, we have back transporting points or back soothe points. These points are more focusing on tonifying, so you can use these points for 脏腑 deficiency. We also have other specific points such as C-clef points, frown mu points, low C points. These are more focusing on reducing. We can use for reducing, we can use for excess syndrome of 脏腑 organs, we can use for acute condition of 脏腑 organs, especially the acute pain of 脏腑 organs. So previously, when we studied acupuncture and Moxibustion, we knew that the 脏腑 organ, the qi of 脏腑 organs, they gather at the back. They gather on the back, on the bladder meridian. That's why from the bladder meridian, we got different back soothe points that related to specific organs, such as the heart soothe points, the lung soothe points. So you can find the numbers. That's why I asked you to try to memorize some of the Chinese terms. That's also another reason why I encourage you to register with the Confucius Institute. Because the back soothe points, especially the one on your back, if you remember the Chinese name, if you knew their function directly, instead of bladder and numbers, those numbers doesn't help you for the functions. But if you knew that some Chinese term, especially the organs, such as the heart, the lung, the spleen, then you will understand the function of those points directly. The qi of the heart gathers at the back on the bladder meridian. These points we call the back soothe points. The difference, okay, before we talk about the differences, the qi of 脏腑 organs also gathers in the frown part of the body. That's the frown mu points. So we have back soothe points, we got the frown mu points. Or the alarm points, so you may just double check the translation. The frown mu points or the alarm points. The alarm points also the qi of 脏腑 organs, they gather in the front part of the body. What's the difference between the frown mu points and the back soothe points? These two different types of points, both of them are where the qi of 脏腑 organs gathers. The only difference is one gathers on the back, one gathers in front of the body, in the front part of the body. One of the most important differences is the back soothe points is more suitable for the deficiency of 脏腑 organs. The frown mu points is more suitable for the excess, especially the excess in organs. The excess of the organs, such as the liver fire, stomach fire, so these are the excess syndrome. The deficiency syndrome we can focus on. We can use the back soothe point more, and because of the deficiency, we also can use the Moxibustion. The treatments can be a combination of acupuncture and Moxibustion. So if you remember here, in future when we study the specific diseases, when you see the spleen deficiency, heart yang deficiency, lung kidney yang deficiency, the treatments you can use Moxibustion. You also can use the combination of acupuncture and Moxibustion. The Yuan source points. In the meridian, the 5 Shu points, we call the Yuan source points. The Yuan source points can treat the specific organs. It has the function of reinforcing and reducing. It can be used for acute situation. It can be used for chronic situation. It can be used for deficiency and excess. When you understand the function of the Yuan source points, you will know that we actually can use a lot Yuan source points in different situations because it can be used for either situation, acute, chronic, excess, and deficiency. It has the function of tonifying. It also has the function of reducing. This is one of the most typical functions in acupuncture as well as in Chinese medicine. The same function have two totally different indications, reinforcing and reducing. Another example we can use is Tianshu. Tianshu, I will give you the spelling. If I'm not wrong, it's number 25. So double check the number. Tianshu. 2 cun, the baby button. 2 cun against the baby button on each side on the stomach meridian. Tianshu. This function, this points can be used for constipation. This points also can be used for diarrhea. So if a patient suffers from constipation, you can put 2 needles here. You can activate the movement of the intestine. A patient suffers from diarrhea, you also can use these points. You have 2 very different functions. This is one of the most typical situation in Chinese medicine and acupuncture. The reason is because the Chinese medicine and acupuncture, the laws of these treatments are actually to balance, to keep in between. The treatments can help you to go back to the middle. The middle of what? That's the balance. Diarrhea move too much. Constipation doesn't move. So the treatments can help you to come back to the middle. The intestine have to move, but don't move too much. That's the middle. That's why the treatments can be used for 2 different types, 2 very different types, both reinforcing and reducing. Also, we need to remember the reducing and reinforcing, or tonify and eliminating. These treatments, we can choose one, we can choose both. We also can treat them at the same time. We also can treat them in orders. For example, I choose to eliminate the pathogen first, and then followed by strengthening the antipathogenity, followed by tonifying the Zangfu organs. I also can choose to tonify the Zangfu organs first, and then eliminate the pathogens. It all depends on individual situation, which situation is more dominant. You're going to focus on the dominant condition.